Welcome to Everyday Vital Path. A frightening truth is hiding in the medicine cabinets of millions of American families. What you trust every day for pain relief, for comfort, could be silently attacking your heart, your most vital organ. As a doctor who has witnessed countless surgeries, I cannot stay silent seeing healthy hearts weaken not from natural disease, but from the very pills deemed harmless. Imagine this: a vibrant, sharp 70-year-old friend of mine was suddenly hospitalized with acute heart failure. The cause wasn't some distant ailment, but the over-the-counter anti-inflammatory pills he took daily for his arthritis. It was a shock, a betrayal from what we call relief. How does that feel? Fearful? Powerless? That is precisely what I want you to be aware of. Today, we will uncover the truth behind the warnings so many overlook. If you are over 60 or have loved ones who are, this is potentially life-saving information. Stay with me until the end of this video. Before we dive deeper, if you value crucial health truths shared clearly and candidly, please support Everyday Vital Path by subscribing. Your simple action is a powerful motivator for us to keep creating valuable content to protect your health and our community's. Now, I have a quick question for you. Be honest with yourself and let me know in the comments below. Do you often buy common pain relievers like ibuprofen to use without consulting a doctor or pharmacist first? Yes, I sometimes do that. B. No, I always seek professional advice first. Please comment A or B. Your answer is very important. 1. NSAIDs. The nonsteroidal anti-inflammatories. There's an old friend that almost every family has welcomed into their home. It sits quietly in the bathroom cabinet, in her purse, in his desk drawer. We call it by familiar names: ibuprofen, naproxen, the friend that helps us push through the back pain at midnight, the joint ache with every change in the weather. But my dear friend, after nearly 4 decades in the operating and exam rooms, I've learned a profound lesson. Sometimes, what we trust the most is precisely what silently shortens our future conversations. I remember one afternoon very clearly. My patient John, a passionate 68-year-old gardener, came to me with fear in his eyes. He couldn't catch his breath while bending down to tend to his beloved rose bushes. His legs were swollen. His heart, the pump that had worked diligently for 68 years, was suddenly exhausted. John didn't smoke. He ate well. The culprit, it was the arthritis pain pill he took every day, as regularly as his morning coffee. You might be wondering, how can one tiny pill do something so significant? Let me share the simplest perspective. Our hearts at this age are like an engine that's been on a long journey. It still runs well, but it needs tenderness. Those pain pills, in essence, can cause your body to retain salt and water. Imagine pumping up a bicycle tire, but you keep pumping and the air has no way to escape. The pressure builds. Your heart is the same. It's forced to strain, pumping an excess volume of fluid day after day, until one day it becomes fatigued and fails. And more ironically, if you are on medication to protect your blood pressure, this very pain pill can neutralize all that effort. It's like pouring water on a fire, then bringing more oil to it. I'm not saying this to scare you. I'm saying it so we can awaken together. Pain is real, and we need to address it. But is there a gentler way for the heart that has loved us for a lifetime? Next time the pain comes, instead of automatically reaching for the bottle, pause for a beat. Ask yourself, do I truly need this right now? Or could it be a warm compress, some gentle stretches, or a phone call to my doctor to find a more heart-friendly alternative? Because, my friend, our health at this stage is no longer about grand battles, but about the deliberate and loving choices in every small detail. And that small detail might just start in your own medicine cabinet. 2. Oral decongestants containing vasoconstrictors. Some colds come not only for the body, but sometimes even knock on the peace within our hearts. Do you remember that feeling? The congested nose, the heavy head, and you reach for that decongestant in the cabinet, the one advertised to bring easy breathing in just minutes. But today, I want to share with you a hidden corner few talk about. Those little pills, containing ingredients like pseudoephedrine, don't just work in your nose. They are full-body traffic controllers, commanding your blood vessels narrow down. I remember my patient Margaret, a passionate 75-year-old retired teacher. One winter, she caught a bad cold. To breathe easier and keep up with her housework, she used a common over-the-counter cold medicine. After just 2 days, she called her son in a panic. My heart feels like it is going to jump out of my chest, and my head is pounding. At the hospital, Her blood pressure had skyrocketed to alarming levels, accompanied by cardiac arrhythmia. The culprit was no mystery. You see, our bodies at this vintage age, like machines that have run tens of thousands of miles, are deeply worthy of appreciation, but also incredibly sensitive. When a decongestant causes blood vessels throughout the body to constrict, the heart, which has worked tirelessly for decades, must now strain to pump blood through a suddenly pinched pipeline system. It's like trying to force a strong stream of water through a kinked garden hose. The pressure surges, for a heart already bearing the marks of time, or struggling with blood pressure. This can be the breaking point. Recently, European health agencies have issued even stronger warnings about these drugs due to their association with rare but serious cerebrovascular events. This shows their power is not small. So, what should we do when cold season returns? Or allergies pay a visit? Safer choices always exist. It could be a simple saline nasal spray, a humidifier in the bedroom, or prescription nasal sprays that act only locally. They are gentler and target only the area needed. Remember this, every choice for immediate comfort carries a potential hidden cost. Next time you reach for that bottle, ask yourself, am I trading breath through my nose for peace in my heart? Choose a gentler, safer path because your heart deserves nothing less. 3. Proton pump inhibitors. PP is a question I often ask myself after many years in practice. Are we building a protective wall on one side only to accidentally poke a hole in the other? This is most evident with a familiar type of medication, the stomach protectors, known as proton pump inhibitors, omeprazole, pantoprazole, names that sound like a promise of safety. And they do work. They soothe the burning, push back reflux, and help many find peaceful sleep. But you know, in medicine, very little is free. Every intervention carries a cost, especially when the duration of use stretches into years. I had a patient, Helen, age 68. She was prescribed omeprazole for reflux and took it faithfully every day as part of her breakfast. It became a harmless habit until one day she felt unusual palpitations, like fluttering in her chest. Upon examination, we discovered her heart rhythm was dangerously irregular. The root cause, after several tests, was that her blood magnesium level had plummeted to a critical low. You might ask, what does a stomach pill have to do with magnesium? The connection is subtle and worth pondering. These pills work by reducing stomach acid, what we often think of as the enemy, but that very acid is the essential gatekeeper for absorbing certain vital minerals. Like magnesium, magnesium isn't just any mineral, it is the conductor of the heart's orchestra, keeping every beat regular and stable. In its absence, the heart can play dangerous, discordant rhythms. That's not all. Some observational studies also point to a worrying link between long-term use of these drugs and the risk of blood vessels hardening. One theory suggests they may reduce nitric oxide, a molecule that keeps our blood vessel walls soft and flexible. Think of a new rubber hose versus one that is dried and stiffened with age. Which one is more likely to burst under pressure? So, what is my message here? It is absolutely not panic or stopping your medication on your own. That could cause more harm. The message is awareness and dialogue. These drugs were created for short-term treatment courses, but life has turned them into long-term companions. Next time you see your doctor, if you are taking one of these, gently ask the question, "Doctor, could we review whether I still need to be on this medication at this dose? Are there alternative options or ways to manage my symptoms without relying on it long-term?" Because, in the end, health is the art of balance. And sometimes, protecting one part of the body too zealously can unintentionally tire another part. Be the wise steward of your own body. For fluoroquinolone antibiotics among us, we've all had our small battles with infection. A urinary tract infection, bronchitis, and in those prescriptions, a powerful class of antibiotics with names like ciprofloxacin or levofloxacin sometimes appears. They are called fluoroquinolones. We often think of antibiotics as loyal soldiers, fighting only bacteria. But what few know, and what even many of my colleagues need to be more cautious about, is that some of these powerful soldiers can sometimes leave collateral damage on the very structure of our biological house, specifically on the largest blood vessels and the most important heart valves. The U.S. Food and Drug Administration (FDA) has issued the clearest warnings about this. They found that this antibiotic class can increase the risk of aortic dissection. Imagine a section of pressure-bearing rubber hose ballooning and tearing. and cause aortic valve regurgitation, making blood the heart just pumped out leak backward. I want to tell you about a patient that has always weighed on me. He was in his 70s, a retired professor, who came to me with severe chest pain. He had no history of severe hypertension or terrible cholesterol, but 3 months prior, he had completed a course of these antibiotics for a complex infection. When we did a CT scan, the images showed his aorta, the body's main superhighway, had begun to dangerously dilate. That temporal connection gave us a lot to think about. The mechanism isn't something I want to overcomplicate for you, but understand it simply. These antibiotics, and their process of attacking bacteria, can sometimes affect enzymes responsible for maintaining the strength and elasticity of connective tissues, the reinforced concrete that makes up blood vessel walls and heart valves. In a youthful body, resilience and reserve might compensate, but in a body that is weathered over 6 decades, those effects can become serious. So, does this mean we should be afraid and refuse them entirely? Absolutely not. In life-threatening infection scenarios, they remain powerful and necessary weapons. But the crucial message here is informed choice. Next time, if you or a loved one is prescribed an antibiotic, especially for more common infections, become a proactive patient. You can ask your doctor one simple yet responsible question. Doctor, for my current infection, is there an antibiotic option that is safer for the heart and blood vessels of someone my age? Because modern medicine is always the art of balancing benefit and risk. And as the stewards of our own bodies, we have the right and need sufficient information to find the best balance point with our doctor for our long-term health. Use the power of understanding to protect the heart and the blood pathways that have nourished you all your life. 5 tricyclic antidepressants. Sometimes, to heal one wound, we must open another door, and that door can lead to an unexpected room. This is most true when we speak of pain. Not the ordinary physical kind, but the pain of damaged nerves or the weary burden of the mind. Tricyclic antidepressants, with names like amitriptyline, were once the key to those doors. But after 35 years in practice, I've learned this: a dose of medicine is not just a chemical molecule. It is a complex conversation with the entire body, and for our aging hearts, that conversation can sometimes become overwhelming. Let me tell you about Frank, a 78-year-old skilled carpenter. He suffered searing, knife-like pain in his feet from diabetic nerve damage. His doctor prescribed a low dose of amitriptyline for pain relief. It worked. But then, Frank began feeling dizzy every time he stood up from his favorite recliner. One morning, he stood. Everything went dark, and he fell and fractured his hip. The cause wasn't a slippery floor, but a classic side effect of this drug class, orthostatic hypotension. It causes blood pressure, which needs to be stable to send blood to the brain, to plummet when we change position. But that's not all. Imagine your heart as a precise but aged machine. These pills can, quietly, force that machine to run a little faster even at rest, causing a rapid heart rate. More critically, they can interfere with the intricate wiring system inside the heart, slowing down electrical signals. On an EKG, it shows as a warning. In real life, it can increase the risk of dangerous, even life-threatening cardiac arrhythmias. Here's the heartbreaking paradox. We use medication to treat pain, physical or mental, which is itself a stressor on the heart. But that very pill can become a new threat. So, what do we do? My message is not fear, but thoughtful redirection. Medicine has moved forward. Today, we have newer, more heart-friendly options for treating depression and managing certain nerve pain. However, this older class is still sometimes used, especially when other options fail. If you or a loved one is taking one of these medications, don't be alarmed. See this as a map to begin an important conversation. At your next checkup, ask your doctor, could we review whether this therapy is still the safest choice for my heart at my current age? Are there alternative options? And if I need to continue, what should we monitor, like orthostatic blood pressure or an EKG, to ensure safety? Because the truth is, mental health and heart health are not separate. They are two adjacent gardens. Tending one garden must not cause the other to wither. Be the meticulous and wise gardener with your trusted doctor, so both gardens can flourish. 6. High-dose calcium supplements. There's a piece of advice we've heard for decades, so ingrained it has become an article of faith. Take calcium for strong bones. And so, on countless breakfast tables, next to the coffee cup, appeared an extra pill, the high-dose calcium supplement. It became a protective ritual. a talisman against the fear of osteoporosis and hip fractures. But life, as you know, often teaches us that things rarely have only one side, and in recent years, the story of calcium has become more complex and nuanced. Giving many of us in cardiology pause for deep reflection, I want to tell you about Linda, an active 70-year-old patient of mine. She was worried about her bones, so she bought a bottle of calcium supplements and took them faithfully every day as insurance. She didn't smoke, and her blood pressure and cholesterol were nearly perfect. Then one day, she had a heart attack. As we searched for clues, the only suspicious link was the high-dose calcium supplement she had taken for years. You see, here's a poignant paradox: the same substance, but taken via two different paths, can lead to two very different outcomes. Calcium from food, from yogurt, cheese, kale, is welcomed by our bodies in a measured, wise way. Like a slow-moving stream, the body absorbs what it needs for bones, and any excess is handled gently. But when you take a high-dose supplement, it's like a calcium flash flood hitting your bloodstream all at once. Your body, especially at an age where metabolism has changed, cannot direct all that calcium to its intended address, your bones. So, it must find somewhere else to go. One of those places can be the walls of your arteries. Calcium begins to deposit there, making those once supple blood vessel pathways stiff and brittle, a process called vascular calcification. Imagine a soft, flexible rubber hose versus a rigid, scaled-up plastic pipe. Which one is more likely to crack under pressure? The research on this still has debate, but the early data is enough to warrant caution. This is not an indictment, but a wake-up call about balance. So, what do we do with the very real fear of osteoporosis? My message is clear: prioritize the food pathway. Let your meals be your primary source. And if you genuinely need a supplement, which is particularly important for those with diagnosed osteoporosis, that must be a medical decision, not a casual habit. Sit down with your doctor, perhaps your endocrinologist and your cardiologist. Weigh your personal risk of fracture against your personal cardiovascular risk. Ask, based on the state of my bones and my blood vessels, do I really need a supplement? If so, what is the minimum sufficient and safest dose? Because health in our later years is no longer about focusing on individual body parts in isolation. It is the art of caring for an entire bodily ecosystem. We cannot sacrifice the health of our blood highways to fortify our skeletal frame, or vice versa. Seek harmony. Let your choice be an informed choice, guided by expertise and a deep concern for your whole self. So, we have journeyed together through something important, revisiting 6 medicinal companions that many of us still trust, from the daily pain pill and the stomach pill to antibiotics, nerve medications, and even supplements. Each carries a mission of healing, but also harbors silent conversations with the heart. The greatest message today is not fear, but the light of awareness. Once we pass the age of 60, the body is no longer a youthful machine that can easily self-correct. It becomes a delicate masterpiece, requiring more tender care and deeper understanding. Every pill we introduce at this stage is like a guest, and as the host, we have the right and the responsibility to know who that guest truly is and how they will interact with the other guests in our home. The deepest lesson I want to leave you with is this: health in midlife and beyond is no longer about passive compliance. It is the art of active, intelligent co-management. Your heart, after a lifetime of tireless work, deserves that meticulous attention. So, how do you apply this to your life right now? Start with the simplest action: create a health list. Take a piece of paper, write down everything you are taking: prescription drugs, over-the-counter medicines, supplements, even any herbal remedies. Put that paper in your wallet or purse. Next time you see any doctor, whether your primary care physician, cardiologist, or other specialist, take it out and review it together. Ask, based on this list, are there any interactions I should be aware of? Is there a safer alternative for my heart? This isn't about doubt. It's about the smartest collaboration. The path to a vibrant life isn't a path without medicine. It is a path of understanding, dialogue, and intentional choice. Before we close, I sincerely want to hear from you. Help us understand you better with one simple question: which of the medication groups we discussed surprised you the most? And what specifically struck you about it? Please share that in the comments below. Your story and perspective could be the key to helping someone else in our community. And if you found this exploration valuable, I warmly invite you to subscribe to the Everyday Vital Path channel. Your subscription is a tremendous encouragement, giving us the motivation to keep seeking and delivering clear, profound, and trustworthy health information, walking alongside you as you protect your most valuable asset, your health and your clarity. Through the years, thank you for listening. Take excellent care of yourself. I look forward to our next journeys together.